So healthcare professionals have been under a lot of pressure since the start of the pandemic.
Doctors and nurses dealing with the things we all are: masks, social distancing, limited gatherings, along with the emotional weight of treating and even losing multiple patients to COVID-19. Joining us live on Skype is Dr. Elizabeth LaRusso, a psychiatrist from Allina Health, to talk about some of these challenges, how we can be supportive too, Elizabeth, because we know our healthcare professionals need that network of support, right?
They do, yeah. And I think that the really important thing to know is that it is really exhausting at this point of the pandemic for everyone, and no one more than healthcare professionals who are just tasked day in and day out with taking care of really sick folks and soldiering on. So the more that we can do as a community to help stop the spread of COVID is the best thing we can do to help support our healthcare workers.
And we know that healthcare workers, by their nature, are giving people. So they're not really all that likely to ask for help when they need it, whether it's even physically or emotionally.
That's right. We're taught in training to basically ignore all of the physical inputs coming in from our body, right? Like a surgeon can't be paying attention to the fact that they're tired if they need to get through an 8-hour surgery. So docs are really bad at noticing what's going on for them physically, emotionally, and psychologically. So it's rare that someone is going to say to a family member or to a friend, hi, it could really help me out if you would sit down and chat with me about how I'm feeling. That's just not how we're wired.
Yeah. Yeah, and I think a lot of us, when my sister's a nurse, and sometimes you worry, you're like, well, I don't want to make her talk about something that she may not want to talk about. What advice do you have for kind of getting that conversation started?
That is such a great question. I'm so glad you asked, because so many people worry that if they bring something up, for example, if they bring up suicide, that it's going to somehow plant some negative idea in someone's mind. And all of the data and all of the evidence would suggest otherwise. So yeah. I think just asking open-ended questions, checking in, hey, how are you doing? This has got to be hard. You want to talk about what it feels like, or just, hey, I'm here for you. Like, how are you feeling? Yeah. And don't feel like you have to have an answer, and don't feel like you have to have a solution. Just listen.
Mm-hmm. And doctor, we know that probably one of the best ways to help healthcare workers is for us to do our part in continuing to social distance, continuing to wear our mask, wash our hands.
Get a vaccine. Absolutely. All of those things, not only are those the best things we can do for healthcare workers, those are the best things we can do for our community. And I think that back to the point about docs and nurses, et cetera, not reaching out and asking for help, I was taught in my training that we should never worry alone. And I would encourage everyone to reach out if they're worried. Yeah. And I would encourage those who are neighbors to drop off food, shovel a walk, do something tangible to help support and care for the people that are caring for you.
Dr. Elizabeth LaRusso, Allina Health psychiatrist. Thanks, doctor. Appreciate it.